Now, if you have fatigue, hair loss, cold body temperature, weight gain, I recommend a full thyroid panel. Again, most doctors are going to just get a TSH. I want you to ask them for a free T4 and a free T3. This is telling you what's metabolically active in the central part of the body, peripheral. If you have cold body temperature, this free T3 is the master kind of thermostat of the body. So if someone's coming in saying, I'm always cold, I go to the doctor's office and they're testing our temperature now since COVID, right? Everybody's measuring temperature and fever and stuff like that. If you're always like a half a point or a point, or they're even cold in the summertime, like my hands or feet are freezing, you get a free T3. And if your free T3 is low, then improving that metabolic function naturally or through prescriptions is really important for the patient because it can actually change their whole lifestyle, especially with some of their symptoms that they're suffering from. Hashimoto's thyroiditis is also common. And in fact, since COVID, we know that people who got COVID have doubling the risk of getting Hashimoto's thyroiditis. And also for their blood sugar, there's a 10% risk, 10% increase in patients who didn't have an elevated A1C just by getting COVID, causing inflammation in the pancreas, having it go up, right? And also like Epstein-Barr virus, 30% in the chronic fatigue patients. So we have to even look, I did a lecture recently on long COVID and how we can help those patients going forward. But Hashimoto's thyroiditis, so making sure that we're looking for the antibodies, TPO antibodies, thyroid globulin antibodies, because that reflects, endocrinology has a problem sometimes because they'll say, once you have Hashimoto's, you always have Hashimoto's. But we look at it differently because we look at it as a marker of inflammation. So if someone comes in and is flaring, their thyroid and their symptoms are terrible. They don't feel good. But if we put them on an anti-inflammatory diet, we give them natural anti-inflammatories, we help strengthen their immune system and fix anything else that's imbalanced or dysfunctional, their thyroiditis antibodies can go back to normal. And we see this almost so often. It's unbelievable. And people are like, but I was told it was always going to be elevated. I'm like, that's because they're not telling you what to do to help rectify and bring that back to balance. Now, if you have, again, fatigue, hair loss, cold body temperature, weight gain, medical options are levothyroxine, brand name Synthroid or Tyrosine, liothyronine, which is T3 synthetic. Some people who who have trouble with the conversion of their T4 to T3, that's when they would go for Armour Thyroid or Nature Thyroid or NP Thyroid. Those both have the T4 and T3, but it's from the porcine gland, meaning the animal pig gland of its thyroid. Now, these are all prescription drugs, so someone who has to have a license to provide those things. I recommend actually whatever's best for the patient, right? So I prefer generics versus prescription the expensive brand names, but some people actually have to use, unfortunately, the brand name because they might have a sensitivity to an inert ingredient in the generics. Some people don't want to take a Nature Thyroid or NP Thyroid because they're vegan. I don't want to have any pork products. Some people have religious issues. They can't have pork, right? Some people, which I see is about 30% of my practice, for example, either drug, synthetic, or the animal gland, the doses are too strong or too low. So the right in between. It's kind of like, you say if there's a 75 and 100 micrograms in a dose, they're like 75 is too little, 100 is too much. And the regular doctor, or sometimes the other alternative practitioner will say, well, either double up on this day or take one less or skip a day or double up like that on the weekends. That's the wrong way to do it. You need to keep the metabolism, you need to keep the thermostat stable for the metabolism to work well. So what we like to do, and one of my specialties is doing, is working with the patient either with their provider or telling them how to tell their provider, or if there's a compounding pharmacy that is available that is nationwide that we utilize, we like to compound the medication. So I can make a prescription for T4, T3 at any number in between a regular dose. And even the Armour Thyroid and porcine thyroid, we can have that compounded at any dose. So we can fine tune and now start individualizing medicine. Now, again, most people 70% off the shelf. Here's a dose. Fantastic. That's great. But for that 30%, it's like, I just can't fit right. It's too much or too little. This is something that integrative medicine can offer. Now, we also have natural therapies. Now, some people will talk about iodine, right? Which type? I come from the camp of starting low, going slow. The problem with all the iodine sources and all the supplements is that they vary in the potency. So if you're getting a liquid, it can vary in any kind of potency, all over the place. So you want to start with one brand, stay with it, go very slowly over time, making sure that you're not getting heart palpitations, insomnia, anxiety. But we like to use comprehensive products that actually have more restorative and herbal formulations that are balancing. So these are two here, Thyroid Care, and then for those people who need more iodine, they can use very less people that use it, but they can use a higher form of that. But these have things like blue flag and myrrh and ashwagandha and other herbs that actually help tonify the gland. So rather than just going up on a drug, or say someone is just a little bit off and they don't need a drug yet, or they don't want a drug, then we can say, can we tune up the gland first, see if that actually can bring it back into normal function, and then eventually, again, getting off these supplements. For osteoporosis and immune health, checking vitamin D levels, this is now common, but you still sometimes have to ask your provider because sometimes they will only get it once a year. We want it actually between 60 and 100. That's where we see the best immune response for bone health, at least minimal 30. Remember, it's a fat soluble vitamin. Vitamins A, D, E, and K are fat soluble. So make sure that you take your vitamin D at any time, but you really want to take it when you have a little bit more healthy fat in the diet. So if you're having a little bit of avocado or nut butter or some olive oil or something like that, 60% better absorption with a little bit of fat. Doesn't mean you have to overeat fat, but just the meal that has a little bit more. And then now you can see that most people are putting, like D3 and K2 for more of your osteoporosis, bone health, and also for the cardiovascular calcium. So that you'll start seeing now coming back of those fat soluble vitamins in combinations.